Welcome to the University of California, San Francisco Sports Medicine Podcast featuring Dr. Nirav Pandya, Dr. Brian Feeley, and Dr. Drew Lansdown discussing hot topics in sports medicine and society. We hope you enjoy our podcast and look forward to hearing from you.
Okay. Welcome, everyone, to the UCSF Sports Medicine Podcast, 6 to 8 weeks with myself, Dr. Nirav Pandya, Dr. Brian Feeley, and Dr. Drew Lansdown. Today, we're going to go back to the basics and talk to individuals about why and what our path was to get into orthopedic surgery. A lot of medical students right now are deciding, what specialty they want to go into, and a lot of people are applying to medical school. So we felt it was a great time to kind of discuss our career paths. And as many of our audience may or may not know, it definitely is a long path to get to orthopedic surgery, and it's something that you have to make a decision relatively early for. We have 4 years of undergrad where we decide whether we want to go into medicine, 4 years of medical school. Then we have 5 years of residency and then fellowship. So there definitely is a path that you have to take and several steps along the way that make you, have to go into this career and definitely be, ready to engage in the training that's there. So maybe the first question I have for both you and Drew is, why did you choose orthopedic surgery? What led you to this path? Maybe we'll start with Brian.
Yeah, so it was 5 years for me for med school because I did a bonus year in research, and then it was a bonus year in residency as well. So I added a little bit of time on, but I went straight through. So I actually had no interest in doing orthopedic surgery until I was almost already done with medical school. So I thought early on, I was going to do anesthesia because that's what my dad does. I did a couple of days of anesthesia and realized you were beholden to the surgeons and what time you left. And I didn't like that loss of control. I'd done a bunch of research in a cardiac surgery lab, and I thought I wanted to do cardiac surgery, but then kind of realized that that's not the life I wanted. And so kind of right at the start of my fourth year, my last year of med school, I did a quick rotation in orthopedic surgery, looking for something else that I thought I might be really interested in, and thought, well, honestly, the team that I was with was horrible. But I really liked the procedures. I liked the diversity of the cases that you did. I liked how critical some of the good faculty surgeons were of their own work. And I really liked how it felt like you were taking active people and restoring them to activity, rather than in cardiac surgery or thoracic surgery, the things I was interested in. It was largely taking people that had destroyed their bodies through unhealthy habits and then restoring them to some level of function. And also I decided I didn't really want to see patients in the hospital nearly as much as they did. And I felt like I really wanted the surgical part and the patient interaction part to be in a clinical setting, not in an inpatient setting.
How about you, Drew? What about you?
Yeah, so I think a slightly different path from Brian, but when I was growing up, I had an interest in going into medicine, but no one in my family was in the medical field. But I liked the idea of, applying science, being able to take care of people. And it seemed like a great career path. And the more I learned about it, the more intrigued I was about it. And then even in high school, so I had an elbow arthroscopy. I liked to pitch. I wasn't a great pitcher by any stretch, but played high school baseball and had an elbow scope for a cartilage injury, and was just so impressed by what that orthopedic surgeon was able to do for me. And he was great at showing me the MRI and kind of what he was looking at, and he knew I had an interest in medicine, was talking me through what he was seeing on my elbow. And then I couldn't believe like the scope pictures, like that he was able to make these little tiny pokes on my elbow and, look in, treat a problem. And then I actually got better too. And I couldn't throw the same, but, my elbow didn't hurt, was able to use my arm. And it was, he was such a, skilled professional, but then also so caring and helpful through the whole process that, really left a strong imprint on me. And then, through college, I was kind of deciding between engineering, medicine, and I think orthopedics is really a mix between those. It's very much like, applying a lot of those engineering principles to improving function, restoring function, recovering from injury. So I think it's a good mix for that type of mindset. Did research in muscle function, muscle biology, and And then, through medical school, I explored all the different areas. We have to do different rotations, but I kind of kept coming back to, the orthopedics. And I think, the great thing is like our treatments can really work well. So like what Brian was saying, and, we can take these like very serious problems that people can have with function, and then we can, apply these treatments that work and get them back, and, they can, be really successful. And so I think it's definitely an exciting area to, apply those types of principles.
We've seen game film from high school. Your breaking ball just never broke. I don't think that changed after a while.
Yeah, I don't think we had game film. Yeah.
It did. It's like one of those wheeling things that you just spin the tape.
There was film when I was in high school, but
Nirav, what about you? Why did you choose ortho?
So, growing up, my father, when he was alive, he was a family physician. So medicine was something that was like, every South Asian family, you were either a doctor, lawyer, or engineer. So it's definitely something where, that kind of thought of going into medicine was in my family. And growing up in Chicago, I remember distinctly, I think I was in 4th or 5th grade when I was, watching the Bulls play, and I saw this guy come out to the field on the court. Like, who's that guy? Who's that taking care of the athletes? And my father was like, look, if you want to become an orthopedic surgeon or go into sports medicine, that could be your career. And I was like, that's so cool. You get to, be involved in sports and take care of athletes. And I went into college, and kind of that kind of thought of being in medicine was definitely still there. I ran track, and I was in 2 events, long and triple jump, where there was a lot of mechanical principles and kind of physics and how can you kind of maximize performance. And I think naturally then when I went to medical school, my experience kind of both growing up and running those events was definitely kind of made orthopedics kind of an easy fit for me, because it was about improving performance and helping people get back on the field. And, there are multiple ways you can do that. And I really liked being able to use my hands and address a problem right then and there, as opposed to some of the other fields where it was definitely a more longitudinal, like you put someone on medicine and hopefully their lab values will get better, or you do a procedure and then hopefully they'll get better, as Brian mentioned, kind of in the long term. And I like the fact that something was broken, you fixed it, and people could get back and be active. So for me, ortho kind of fit in with all those various kind of check boxes, and obviously very happy that I made that decision and love what I do. One of the questions, we ask sometimes in interviews, Brian, but maybe get a perspective from both you guys. What would you have done if you weren't going into orthopedic surgery? What was your other non-medicine career choice?
I think for me, probably I would have done some sort of field in general surgery. Like I said, I really liked either end of the spectrum. I really liked very, very sick patients, like intensive care, or I liked patients that basically got up and went home after surgery. That in between of managing patients on the floor, I just felt wasn't intellectually all that stimulating. And the ICU felt closest to what I was comfortable with by following my dad on rounds and seeing sick patients when I was a kid. And I like that idea of like, that is kind of like ortho or a lot of the surgical fields where you change something and patients either get better or worse. So you get to affect change really quickly. Outside of ortho, other than ICU, like I dabbled with the idea of doing pretty much everything for at least a week, but ultimately decided I really liked surgery over medicine over pathology and radiology. And then kind of like what you said, like, I think ortho is great. And in hindsight, I would have said, there's no way I should have picked anything else. What about you, Drew?
So, I mean, I liked most other fields in medicine too. I think there's so much that is, like it is interesting, it's rewarding. And I think like, I really liked cardiology also. I think that, how the heart functions and, the flow mechanics, the electrical part of it, like it's all like this very, interesting, intricate system. And then, I think like radiology, I think medical imaging is a really interesting thing. And then there are fields like interventional radiology where it's, still kind of procedural based and you're doing something with that as well. And I think like neurology and neurosurgery too, just like how the brain works is still like, I think it's something that there's still a lot to be learned, and but still some things that can be done on an interventional basis that are pretty intriguing too. What about you, Nirav?
Yeah, I think for me, the one other field that I pondered with a little bit was ER. I kind of like the fact that someone was acute, you can kind of help them through like a critical situation or a time when they're kind of in need. And for me also, I think it is unfortunately a place where a lot of people get their primary care medicine. So I think the ER is more than just like you have a cut, you have a heart attack. It was a place where a lot of people in the community went to actually get plugged in. It was their only really interaction with the medical system. So I think that was kind of unique, especially with the place where I went to medical school in Chicago, and Drew was there as well too, University of Chicago, where the ER there was more than just about emergencies; it was about the gateway to the rest of the medical system. So that definitely sparked my interest. From a surgical standpoint, the only other thing I think was that kind of general surgery, trauma surgery, kind of the acuity of it and being able to take care of things kind of right away. But obviously, I think ortho was well ahead of everything else in terms of specialties. But yeah, there's so much in medicine, and I feel that once you become a specialist in an area, you really kind of dive into it. There's so many as compared to 30, 40 years ago, everything is so cutting edge, and there's so much research and putting it into practice that makes any kind of field very exciting.
Yeah, I think that's a good point. I didn't really mention how much I liked the research in ortho and the stuff that I had done in cardiac surgery. I felt like was a natural transition over into skeletal muscle, which frankly was pretty far behind cardiac surgery at that point.
Yeah, I agree on, the research side. And I think like orthopedics is cool because like the treatments we have right now, they're good. And so it, makes sense to use them, to practice it, but there is still a lot of room for improvement in both what we're doing and like our understanding of it. So, for people who have that curiosity of improving something or innovating, like there's so much that can be done in orthopedics.
Yeah, especially on the mechanical side. Well, on the biological side too. Well, all of it.
Yeah.
So and this might be a tough question, but what do you think the biggest myth is of orthopedic surgery, especially for people who are thinking about, no, I might not be a good fit for orthopedics?
Maybe I'll go first. I think that there's, basically the myth that you have to be, a former collegiate athlete who's really, 250 pounds, can bench press, 400. I mean, as someone who's on the smaller stature size, I think that it's ortho is not just necessarily about all those things. I think there are people who, contribute to orthopedics in different ways. And a lot of it is, yes, there's a lot of physical parts of surgery, but a lot of it is about decision making. There's a lot of science behind it. So I think the fact that the stereotype of who goes into ortho, I think isn't necessarily true. And also, I think the number two thing as well, too, is that not every orthopedic patient is an athlete per se. I mean, there's a lot of things we do in terms of returning function to individuals, whether it be elderly individuals, young pediatric patients. So the patient population, I think, is a lot more broad than people conceive. And there's a lot of things we do to help improve function and structure and traumatic injuries in individuals. So those would be my two.
Yeah, it's funny that you mentioned that, because I think sometimes in sports medicine, patients will come in and say, well, I didn't think I could be seen in this clinic because I'm not an athlete. I'm like, well, sports is sports, especially for shoulder problems. And we end up seeing a variety of different things that just fall into the specialty that I think we at least got privileged with being able to use a fun name. I think especially with the residents, I think the biggest myth that we encounter is I'm not strong enough to do something. And in fact, I have zero grip strength. I seem to have the ability to squeeze things at the level of a 5-year-old. Yet there hasn't been anything I haven't been able to do without just changing the lever of how we're doing something in the OR. And I think the really good residents are actually the ones that aren't quite as strong and figure out how to use their bodies well. And I liken it to how good hitters, regardless of their size, Barry Bonds and Mark McGuire accepted, can hit the ball out of the park, but it's about how you use what you have rather than trying to lever just strength. What about you, Drew? Drew does bench press 400 pounds.
At least, yeah.
100 pounds 4 times.
On a light day. Yeah. No, I'd agree. And I think like there is that feeling often from, I think, medical students that like, oh, I don't fit in with that perceived person in orthopedics. But I think that has really changed and continues to evolve. And I think it is a field that like it is really broad too. Like when you think about, so like, we do sports medicine, like, arthroscopy. So we're doing minimally invasive surgery, like watching on a TV screen with, little tiny instruments to, major joint replacements, to spine surgery where you're working around nerves and the spinal cord, to pediatrics where, some of the congenital hand reconstructions, you're, these tiny little, reconstructions on, newborn hands. I think it really spans the spectrum. And I think there is something in it for most people if they have that, interest in the area. And can be a very rewarding field no matter what that area is.
Yeah, no, absolutely. And, I think as we kind of reflect back, what are some of the things that surprised you the most? I mean, Brian, obviously you've got the most experience. I'm kind of in the middle, and Drew, what has surprised you most about the field, particularly as you begun your practice? Maybe Brian, go first.
Yeah, I'm 2 years ahead of you. We're basically at this point.
It's like decades experience difference.
Yeah. I think that's a good question. And I wrote the question, so I should have thought of this a little bit better. I think what surprised me the most is how quickly the persona in ortho changed, especially in the last 5 years. When I started in ortho, it was kind of the stereotypical, at least where I rotated for med school, it was a stereotypical, like 5 white dudes, who 3 of whom played college athletics, were all strong, talked about where they like to go out. And it did feel like something I absolutely abhorred, but really liked the science, and I liked the surgery, and I liked some of the other role models that we had in the faculty, if not the residency. I feel like that's really changed. And I think ortho has gotten progressively, but really rapidly, more diverse, much more accepting and welcoming of anybody who wants to do it. And I feel like as much as it still looks on the surface like a largely predominantly white male program or institution, in the next 5 years, as more residents and more women come through, it'll change really quickly. And I think that's been the nicest surprise as well. What about you, Drew?
Yeah, I think, in a different direction, I think one of the biggest surprises is I think, it's that thought of like, the more you know, or the more you learn, the more you realize how much we don't know. And I think I remember in medical school seeing like studies on ACL, and it's like, why are there so many like papers on ACL injuries? Like, why would people write that much? And then now, like, here I am, like, and that's what I'm studying and writing about. And it's like, it's just a little ligament in the knee, but then you think of all the downstream effects. And I think as you start to get into some of that science, it's like, sure, we know this about it, but there are still endless unanswered questions. And our treatment is good, but it's not perfect. Like, you still have risk of arthritis, still have these like this long recovery, like all these limiting factors. And so I think for as advanced as our field is, I think it's still a surprise at how limited some of our understanding can be at this point even.
And I think for me, the one thing that surprised me the most, and we all do sports, so I think this sports medicine, so I think we understand this, but is how much what happens to patients afterwards really is dependent on how much they rehab and how much they do their exercises. And, when you're going through as a medical student resident, all you see a lot of the times is the surgery. And then you see them once in clinic, but you don't follow them longitudinally over years. And it really is amazing how much of our field is really based on teamwork and working with every aspect of care. It's their physical therapist, it's their primary care physician, it's their athletic trainer at school, and how much we're interfacing with various people in care as opposed to just the surgical part. So, I always joke with the patients, I did my hour and a half of work in the operating room. Now it's a lot of it is based on what happens outside. And it really is, how amazing that you can do the same procedure and everything's variable based on, their access to PT, not just if they're doing it, but if they have those, things at their disposal, their social situations, et cetera. So it really, even though we are doing something where we feel like, I'm fixing it right in front of me with my hands, there's so much that goes into how everything it works out functionally. So I think you learn more and more of that as you go on your career. But as a resident medical student, you don't realize how much an outcome isn't just how good that plate went on the bone or how good that ACL went. It's all those other factors as well too. Would you guys do it again? Would you do ortho all over again if you had the choice? Maybe medicine first, then ortho second. What would be your thought, Brian? Would you encourage your children to go into medicine, or would you go and do it again?
Yeah, I encourage my children to do whatever they want, but I think medicine's a great field. I think it has a really nice mix of doing something different every day, which I think is important. Like, I think the idea of sitting in an office and doing the same thing on a daily basis, I think would be the worst possible job. I really like that of the 5 days of the week, every day feels distinctly different. So yes, I think medicine is great. And then ortho, absolutely. And I was trying to think, would I do anything differently? And I think the fact that I wasn't sure what I wanted to do in a surgical field until I was already at least considerably through medical school actually was pretty helpful, because I think it allowed me to not key in too early to orthopedic surgery. But I do wish I'd spent a little bit more time on psychiatry and rotations that allow us to think about how other people think and how your brain can help or hinder your recovery process. Because I think that's something in the surgical fields we don't really get.
How about you, Drew?
Yeah, I would do it again. And I think it's a great field. And I think, in advising others, especially, before medical school, things like that, it is a long path. And then if you're not really interested in it and not really like engaged in it, it's going to be even longer. But, if you're intrigued by the concepts, the ability to care for people, to, change function, things like that, then the process isn't that long, because, that's what you're doing. And, but if it is, like you're kind of forcing yourself into it, it's going to be definitely going to be a slog through it. And so would not recommend unless really engaged in it. Because I've definitely seen some people who, the engagement isn't there, and it, I think, is not as enjoyable of a profession to be in.
Yeah, no, and I totally agree. You have to be fully engaged in it because of the path, and it's hard to really succeed and give the best care to your patients if your heart's not fully in it. So absolutely, I think I would definitely agree with that. And just like both of you, I would absolutely do this again. I just like Brian, I like the diversity of the day. I like the fact that I get to talk to people, on my non-surgical days. So I think it's just the ability to interface with people, work with so many different people in the hospital. I think it's a great field, and get people back to their function. So absolutely, I echo what both of you said. So in the interest of time, once again, thanks everyone to listen to our podcast. Hopefully this gave a little bit more introduction into ortho medicine and kind of what drove us into our specialty, and hopefully we'll inspire some people to go into the field as well too. Thank you.
All right, thanks.